Thank you for watching this and all the other training videos. And I would like to talk initially about reducing sexually transmitted infections. My name is Dr. Anatol Melny-Hansen, a UK physician working in sexual and reproductive health. In 2019, there were 2.9 million sexually transmitted infection cases in England and the USA. These are the sum of the chlamydia, gonorrhea, syphilis and HIV diagnoses. And globally, there are 11 STIs diagnosed per second. And these infections are rising. And this data from gonorrhea in the United States shows that we're now in the third peak, and there's a real risk that will increase the incidence so that it matches that was seen pre-HIV/AIDS in the early 1980s. And certainly in the UK, we've already surpassed our pre-HIV peak, and in 2019 it was the highest number of recorded gonorrhea cases in 100 years of measurement. Now, the cost to diagnose one case of gonorrhea within the people you test depends on the incidence. And as you can see, from New York State to New York City to New York County, there's an increase in the incidence rate, and that brings down the cost to make a single diagnosis. But if you test partners of infection, and we know from national data from England that 410 for every 1,000 partners of gonorrhea tested are found to have the infection, and that significantly brings down the cost to make a diagnosis. However, reaching out to partners is difficult because of the embarrassment that patients have and the stigma associated with sexually transmitted infections, the fear of rejection and potentially violence when diagnoses are made, and of course all of this centres around privacy and the concerns about that. And this work is time consuming, and many staff find it hard to deliver effectively. And data from Washington State show that over 3 areas they were able to, on aggregate, get 30 partners tested per 100 index patients. And even though that's such a small number in relation to the number of contactable or contacts that those individuals would have had, it still would have yielded 12 infections from the 30 partners testing. And in England, we have data showing it's 37 partners tested per 100 index patients. So there's clearly some good work to be done. But an improved process would increase partner notification rates. But it needs to be simple to use, it needs to be private, it needs to be secure, and it needs to result in a clinic visit of the partner, which is the key outcome metric. Obviously, such a service needs to be cost effective. It has to genuinely reduce the clinic staff workload and increase access for at-risk patients. And I'm looking forward to sharing the remaining training videos with you on what we've managed to create in SXT.